we think about maternal and child health, that's certainly a global health issue. And, you know, when we talk about the global health piece, what, you know, what specifically comes to mind? You have any thoughts there when you say, you know, global maternal and child health? And Zoe, I'm not picking on you, I promise.
No. I'm just trying to think of how to word it, but I think a lot about like access to healthcare and like societal burdens that people face and trying to get rid of those, and also just trying to make a more even distribution of healthcare, so everyone, whether they're like a woman, a child, everyone can get the same access.
Yeah, so equity and access to care, that's great. That's awesome. And so you said global MCH. What are some of the, you know, when I talk about when we say maternal and child health, so what are, you know, we'll kind of bounce back and forth between this, but you know, when populations, what populations come to mind? And I promise this is not a trick question, even though it may seem like one. It's how about moms? What other what other
children?
Children, yeah.
I think it would also be just women in general, because
Women's, yep. I'm sorry, I interrupted you.
I think about
Women, yeah.
Children specifically, like as they're developing.
Mm-hmm. Oops.
Teenagers.
Teens or adolescents, yeah. What else? And if I spell something wrong, please don't hold it against me. Other populations?
You know, there was a push several years ago to look at the entire family, which brought fathers into the equation.
Very good.
Yeah, I remember. Oh, I'm sorry.
No, please.
Last semester when I was taking my introduction to maternal and child health course, when I was researching the Title V program, and I had to like talk a little bit about like what is maternal and child health. I saw that there was also like a focus on all kind of like the aspects that influence maternal and child health. So it's not just about you know, mothers and children's or like before pregnancy, but it's also on like different aspects of life that has an influence on where they're at as well.
Yes.
If that makes sense.
Oh yeah. So in terms of, let's see, so we can go back to that other in a minute, but is it kind of topical topics that are a focus for maternal and child health? Is that a fair way to say that, Sylvia?
I think so. I also know something that was highlighted back when I was, you know, first doing research more so on like the maternal and child health is like the blanking on the life course theory was something that
you're so good. Yes.
Was a big topic.
You are right. And I'm going to hit on that in a minute. So, you know, I think, you know, when we talk about the population, certainly, in terms of, you know, we talk about women, we talk about children, we talk about infants, we talk about fathers, you know, we could, if we're thinking about it along when we think about the life course perspective, that's really trying to take in like the generational approach. So, you know, you might have grandparents raising children, raising their grandchildren. So, you know, it kind of gets, you know, in some sense, sometimes I ask myself, well, what isn't maternal and child health really when you get down to it? But I think for the purposes of kind of what we're, you know, what we're focusing on here, you know, the topics that we talk about. So, you know, what are some things that y'all are interested in? And certainly some of the things that we're hitting on right now, like I'll just, you know, this is a big one. So immunizations is certainly a big topic. Not for COVID specifically right now for kids, but or for under 18, but that's a big topic in maternal and child health in general. You know, if you think about it domestically or globally, what are some other topics that that come to mind?
Nutrition.
Nutrition, yeah. Other
Oral health.
ideas? Sorry?
Oral health.
Oral health, and yes, I actually, it's interesting. I actually had I helped. I met with a candidate at the School of Dentistry last week, I think it was, and we were talking about how, you know, in public health sometimes we don't talk enough about oral health, but given that you know, dental caries is the leading infectious disease in young children. I think that's right. I think that's the right way to say that. You know, that's a big deal. And if you can't eat, you can't be healthy, you can't learn, you can kind of see how that all sort of fits together.
Yeah.
That's great. Good point. What other? How about family planning?
Injury prevention.
Mm-hmm.
Safe pregnancies.
Mm-hmm. And that kind of goes along with maternal mortality, which there's a lot in the news and in you know, the literature, and it's a big focus right now, particularly when you're talking about equity issues in that area. And we mentioned this earlier. Somebody said, you know, women in general, you know, maternal and child health, I think sometimes we've kind of swung to, well, if you're a woman, the only reason we would care about you is if you're pregnant. Well, that's not true. That idea of really women's health beyond, you know, the reproductive course. What about infant mortality or infant health? And somebody's, okay, sorry, go ahead. Mm-hmm.
Mental health for adolescents and teenagers.
Mm-hmm.
That's coming up a lot now.
Oh, yeah. Yeah, mental health, I think maternal, adolescent, and even, you know, I think even now with, you know, at least, and I'm sure this is from a global standpoint, but a lot of what we're hearing is certainly, you know, a lot of the examples related to COVID are, you know, I heard something about a child as young as the age of 9 committing suicide. I mean, which is so it's, you know, we've expanded what we're talking about there. Any other topics that come to mind?
Childhood obesity.
Yes. Obesity in general, which you mentioned childhood, which certainly is true, but then that also kind of fits with this safe pregnancy piece. And, you know, some of the other nutrition, all these other infant mortality, they sort of, a lot of these dovetail. One group that we didn't mention,
Special needs.
children with special needs. Yep.
Mm-hmm.
Yep. And I think that's really, or children with disabilities, children with special health care needs. There's a lot of different ways to talk about it, but that's certainly you know, a big, and even you know, women with disabilities and, you know, their life course, reproductive health, all of those things. So you can kind of see it gets very broad, but in the end, you know, we have these populations and these topics. But then we also have, I'm gonna add to another whiteboard. Are y'all seeing this okay? I'm not making you dizzy with the whiteboard, am I? Is it working?
Yep,
All
it's
good?
fine.
Ma'am.
Okay, good. This is my first shot at this. I'm trying it. So, you know, but if we think about sort of some foundational components, and I know, like I said, I know we may have a mix of folks from public health, but also from other disciplines. But when we talk about sort of the foundation of MCH, some of the things that come to my mind, I think, are things like health equity. And we mentioned this earlier, you know, access to care, right? What other, you know, when we say health equity, what are some other sort of MCH issues that come to mind?
What about housing and education?
Oh, go ahead. Education, housing.
Mm-hmm.
Uh-huh. And then I mentioned the maternal mortality and morbidity. Any other thoughts on that? So another, and this is sort of for those of you that are in public health, this idea of social justice. Social determinants of health. You know, the idea that, sorry, dinner is being fixed behind me and I'm getting distracted. The social determinants of health. So thinking, you know, if we're talking about children, for example, you know, you've got to think about children in the context of their environment, in the context of their family. And so social determinants of health, but also, are y'all familiar with the social ecological model? Anybody?
I wouldn't bet that everybody is. I do tell.
So the social ecological model, for those of y'all who don't know, so you have sort of the individual here. And if you think about, you know, a child per se, and then you have sort of the child in the context of the family. What do you think the next ring is?
Community.
You have, yeah.
Go ahead.
Community.
Community, yeah. And there's different words that you can sometimes use to describe this, but this big kind of outer circle, what do you think that is?
Societal, policy.
Societal. Okay, Sylvia, you could teach. You gotta, since you took that, and I'm assuming it was HCO 605. Since you took it, you know this, right?
Yeah.
So by all means, jump in. So societal, systems, policies, all that other stuff that kind of presses in on community, family, individual. So, you know, thinking about this is automatically, you know, if you're a provider, if you're sitting in if you're a clinician, for example, you know, a lot of times this is your focus. If they're in your exam room, this is your focus. But the idea that all of these other things exist in the context of this one individual is really important. I think the best example, and Julie's probably heard me say this before, but I had a conversation years ago with the former chair of OBGYN at UAB, and he said, one of the hardest things that I have to do is try to teach the fellows and the residents about social determinants of health, about the social ecological model, because he gave me the example. He said they'll get so frustrated because they have a lady who comes in, or a patient who comes in and is not compliant with her insulin, for example. And he said, having them stop and think to say, well, if I'm choosing between this medication or feeding my family, what am I going to pick? So that whole idea of this automatic kind of going to, it goes beyond just that one person. And really that's what we focus on in maternal and child health. Questions, comments, thoughts thus far? You're probably feeling like you're being lectured to regardless. So that's not my intention, but I hope this is at least giving you something to think about.
I have a question, but it's a little
Sure.
related to what we are talking about now.
That's okay. Yeah.
How would LGBTQ people be included in maternal and child health?
That's a great question. I think they definitely are. I mean, I think you think about kind of the issues that are included with that particular population: bullying, schools, education, healthcare, access to care, all of those components. That's my reaction. What do others think?
I got a chance to attend this diversity and inclusion seminar where they were talking about inclusion of LGBT community in all the aspects. So I feel that at that time I just was wondering about how they can be also playing roles of mother, like a family, if they
Sure.
foster a kid, and for them at that moment they would like to know something what is maternal and child health, because it's maternal word is just not related to like a one gender, but it's kind of a role to play and execute.
Absolutely. Yep. I mean, we've even, and even in some of the literature that, with the research and the science, being mindful of, it's not necessarily pregnant women, it's pregnant patients. So being very thoughtful about the language and the approach to some of the work that's being done. So I think that's an important piece, certainly. Other thoughts or comments?
I agree with what Prashti said, and also like as children or adolescents, they are automatically included in maternal and child health. And I feel like they may actually have a little more issues with, like you said, mental health and just getting the proper healthcare access to that, because they need to be open about their choices, even to providers. So again,
Absolutely.
access plays a huge role.
Absolutely. Those are great. And I think these are, I don't know, you all probably know this, but the thing that you are most familiar with tends to be the thing that you talk about, or the thing that my go-to tends to be more in the perinatal health realm. And so, certainly the LGBTQ discussion is so critical. It's just, there's a lot, I think, that's changed over the last, few years. But I think in adolescent health, how that's addressed, and how that's included in research and practice, in public health practice. And I think we're still, in many ways, trying to figure that out. It's kind of like it's taken us a long time to get to where we can have and it will continue to take us a long time to continue to talk about health equity and social justice. And so, the slow moving conversations, but hopefully you know, we're making some progress there. So some other pieces of this, and I'll kind of go back. Somebody mentioned this, the idea of the life course perspective, and I'm going to turn off my whiteboard for just a second now. I'll turn that off, and I'm going to turn my video back on so y'all can see me now, and maybe I can see you. But, you know, with life course perspective, that's really the idea that, you know, you have, you know what, if I say lifespan, what am I talking about? Any thoughts there? Lifespan, so cradle to grave kind of thing. So that idea that, you know, we have birth to death, right? But the idea really with life course perspective is, you know, there's kind of two ideas. That one, and Sylvia, help me here, as since you've learned this recently, you can probably explain it in a less academic-y term than I can. But in terms of kind of thinking about the idea of lifespan upon lifespan upon lifespan. So do y'all know what a slinky is? Do you know what I'm talking about? You know, the little slinkies, the little metal things that go down the stairs. You know what I'm talking about? I'm aging myself here. This is sad. You know, do y'all know what I'm talking about or no? The little, yes. Okay. Thank you. So the way that I've thought about life course perspective is, in one way, it's like this generation upon generation upon generation. And if you think about that connectedness over time and stretched over time, and then there's these places along that continuum that we can intervene, interject, and really make a difference in the life of a trajectory for families, for children, for women, etc. Does that make sense, sort of? Yeah, and okay, my slinky analogy, I'm gonna have to start bringing it, like, to show. I'm gonna have to find one, so I can see it kind of going down the stairs. If you're not familiar with it, it's a good, like, thinking tool. So Sylvia, would you add anything? I'm picking on you since you started talking. So would you add anything to that?
I think you did a good job explaining it. Obviously, you are more so of an expert than I am, but yeah, I would just say, like, you know, different parts of life, you know, something that I picked up when I learned about the life course theory, and I am by no means an expert, but, you know, different parts of life impact another part, which can impact like someone else's. So just kind of how you were talking about with the slinky, like just how interrelated things are, and how, you know, something that might have happened at birth will affect, you know, can affect something that happens in your 20s that can affect something that happens in like your 60s.
Yes. There's something, and now I'm going to go really researchy nerdy on you. There's something called the fetal origins hypothesis. I don't know if you're familiar with that, but the idea that in utero, when in utero, if a baby is born low birth weight, there's an increased risk of cardiovascular disease as an adult. So there's all of that sort of factors into this life course perspective. So the idea of we can't fix something in 9 months is tough. So if, you know, a woman enters prenatal care and has all these different risk factors, to fix that in an immediate way is really difficult. But the idea that we can make adjustments and intervene over time and in different places, like with adolescents, like with, you know, early childhood, in terms of early childhood obesity, et cetera. So there's all kinds of ways to think about that. The other thing that advocacy is another big part of maternal and child health, and I think you hear that on a global scale as well as a domestic. We tend to be the ones that are passionate in terms of the populations and really trying to make a difference there. And I think, you know, there's the role of advocacy, like in terms of legislating and going up and being on the Capitol steps and making policy change. But then there's also the personal advocacy of really trying to move an agenda forward. And, you know, even as a researcher, my job is not to advocate. My job is to provide the evidence that other people can use to advocate. But as a Martha Wingate private citizen, you know, I can advocate for the issues that are important to me. So it's that's kind of an interesting thing. But I think that passion and the advocacy is an important piece of maternal and child health. I think I mentioned this earlier, but the idea of family-centeredness, you know, to say, okay, I was talking to somebody not too long ago about our Medicaid agency is really working hard on childhood obesity issues, and the ACHNs, which are the Alabama Community Health Networks. The state is divided into 7 regions, and these Medicaid these entities are charged with coordinating care for the Medicaid population, and that includes pregnant women and children. And so one of the things that they're really trying to work on is childhood obesity, but it's tough because when you look at the evidence, you know, if you have a school-based program that just focuses on the kid or on the children, that has to translate at home. And the programs that have been the most successful have somehow integrated all of that. So that idea of family-centeredness, that's just one example, but that idea of family-centeredness is so critical for the MCH realm, that idea of, you know, not one person operating in a vacuum. You know, the other thing that we, you know, certainly MCH is evidence-based. You know, we try to look at the science, we look at the science. And in some cases, it's evidence-based or it's best practice, promising practice. Sometimes we don't know, but it's the idea of really basing the work that we do in science and evidence. That's critical. And the interdisciplinary and interprofessional piece. So I think that's another key piece, that it's not just, you know, the physician, it's the physician, the school, the, you know, counselor, the, you know, you name it, and it keeps going. So on that note, I'm going to go back to my whiteboard because I want to take us through a little exercise here. And I know I look like I don't know what I'm doing, but I don't. So, okay, there we go. Okay, so I'm going to take a population. So if we say we're going to focus on children, this is always my go-to with cerebral palsy. And I'm thinking we could do child, but I think this idea of kind of focusing on the population. What are the systems that these children have to interact with? Or what are the entities? If they're like, say, 8-year-old children. What are the systems that they?
Medical systems. It's like hospitals, doctors.
Yeah, can you be specific? More specific?
Like doctor visits.
Yeah, like you would have, I turned my screen off because you were seeing my hand in front of that. So like, is that Nita? Is that Nita that's talking? Okay. So yeah, no, you're close. So if you think about it, like if a child with cerebral palsy, say say you have a child that's in a wheelchair. So they would potentially have to go, they would have their pediatrician, right?
Physical
We'll
therapy.
say that.
Yeah.
Yeah, I think I just spelled that wrong, but that's okay. So you've got the pediatrician, you have PT, you might have, you know, your durable, we'll just say durable medical equipment. I'm sure there's a better word for that. you would probably have your, depending upon what's going on, help me here. What are the, is it neurologists that would put in a shunt?
Yeah,
I should know this. Neurology?
Neurology, yeah.
I think I'm spelling that wrong, but neurologist. Okay, so that's the medical, or at least that's part of. So you might also add OT in here. Yeah.
Yeah.
What are some other systems?
And the speech, I mean, just to make the point that the medical system, that medical system, well, there's also nutrition, social work, speech and hearing.
Yep.
School.
Pardon me?
School, like the
Education. Yes. Okay. And the other thing is, how would you pay for all of these things? What's the thing that you need to pay for?
Insurance?
Yes. Like I said, there are no trick questions.
I feel parents and family, because they will be the one bringing to the system.
Yes. And then they probably need, potentially, depending upon, some respite care, maybe. There might be some counseling in the mix, and we could kind of keep going. But the idea is, in maternal and child health, really the goal, I think, at least, in the way that I kind of encourage the thought process behind these populations. And I know I used, children with special healthcare needs, but you could use LGBTQ populations, you could use pregnant women. I mean, you could high risk pregnant women, you could use anybody as that example, but that idea of, we have to think about, as people that are interested in maternal and child health, you have to think about all those circles and all those kind of bubbles that interact. And because if you're just looking at one piece of the puzzle, you have the potential to miss out. So that's the systems piece, and that's the part that I think is, in my mind, is one of the most critical that maternal and child health, it's that systems approach to these populations. So questions, comments? I hope that was, folks who invited me, I hope that was what you all were interested in hearing about. I hope I didn't bore you too much with a non-class time lecture. Questions or comments? Thoughts? Did you already know all this?
Oh, sorry.
Oh, good. Thank you. Did y'all know, was this a different way of thinking about this, I hope, maybe, or just a little bit different?
I think it was like a crash course on everything in general. And right now I know a lot about these things because, I have already done quite a bit of the classes. But when I joined MPH last year and before my first semester, I was completely blank about this. So yes, this was definitely helpful.
Good. And I think that idea of, for those of you, and again, I would love to know kind of where you are and what you're doing. And I hope that, if you, during your time here, are all of you MPH students or undergrad, or tell me, I know that's hard to answer.
I'm an undergrad in the Accelerated Bachelor's to Master's program.
Okay, well, good. Okay, well, I hope that this fits in with the undergraduate ideas that have been presented.
Yeah, it's definitely a new perspective.
Uh-oh. I don't know if that's good. I hope that's okay. I hope it's not good nor bad. Just yeah. This is a tough, I have to say, I know it sounds silly, but this is always a hard it's a hard lecture. I won't say lecture. It's a hard thing to wrap your brain around because it's a little and to even talk about, because there's so much, but yet there's these key components, like I said, of getting your and even if you say, I'm getting my MPH, but I know I want to be a nurse, or I know I want to go, Zoha, as you said, you want to be a pediatrician, but hopefully this perspective will help you be a better, more comprehensive, and think about your patient population more comprehensively. So I've got undergrad or fast track, accelerated, I'm sorry, it used to be fast track. I'm trying to change my language. Accelerated program, others, or we have MPH, kind of a mix.
Sarah Morgan and I are audiology externs through the LEND program. And so, no, this presentation was very helpful because we get stuck in the mindset of working with the children with special needs groups that we are working with every day. And so it's important to think about the greater picture, because there is more that goes into MCH too. Yeah.
Paige, I think I've seen your name on maybe newborn hearing screening. Have you attended some of those? Okay, yes. I'm working with them on some of the systems stuff right now. I'm working with Department of Public Health on their systems work related to newborn hearing screening. So glad to have a name to go with a face. It's great. So
I think
go ahead.
Jump in, if that's okay.
No, that's fine. No, oh gosh, oh my word, I didn't know what time it was, Julie. I'm so sorry. I looked down earlier. Okay. Oh, I'm just talking. Okay.
No.
Y'all go ahead.
It's exactly what we were hoping for. I did want to make sure that that the officers had a few minutes to just give everybody kind of a 101 on what the Maternal and Child Health Student Association is all about. But before I turn it over to our president, Zoha, to get us kick-started, I did want to let you all know that Dr. Wingate had talked about advocacy, and the second event that we're planning is on the calendar for February 20th at 5 p.m. And it's going to feature Britta Settergren, who is nationally with the March of Dimes. And she's going to be talking to us a little bit about her career journey and a little bit about the March of Dimes and what they do and how we can get involved if we'd like to. But the majority of that event is going to be a crash course on how to effectively advocate for what matters to you. And one of our community service events for spring is going to be coming alongside the March of Dimes and participating in some of their advocacy activities if we'd like to. But the information she provides would be helpful for not only advocating on behalf of the March of Dimes, but on behalf of whatever it is that's important to you. So put that on your calendars, and MCHSA will start advertising for that very soon. And so I'm going to share my screen because the officers put
I'm going to jump off, but I thank y'all for letting me join in. I'm sorry that I took so much time. But Britta is awesome. She's a good friend, dear friend of mine, and she is a rock star in terms of maternal and child health advocacy. She's great. So I know y'all will learn a lot from her, but I'm going to jump off. Thank y'all. If you have any questions, hopefully you know how to get in touch with me. If not, Julie definitely can. Y'all take care and have a good night. Thank you.
Thank you.
Thank you, Dr. Wingate.
Thanks.
Okay, Zoha, I'm gonna turn it over to you.
Thank you, Julie. I'm going to keep it really short. I'm sure everyone just wants to maybe talk a little more. So we are the Maternal and Child Health Student Association, and we are just a student-led organization in the School of Public Health. Julie, you can go ahead.
All right, hang on. Oh, there we go.
Okay, so I know a lot of you guys are already members, but those who are not, we are the student-led organization which are part of the School of Public Health, HCOP, that is the healthcare organization and policy department. And so we have both graduate and undergraduate students, and the student association is not limited to only MCH students or even just for MPH, like Masters of Public Health. Anyone can be a part of it if they are interested in maternal and child health. So we just try to share just exactly what we had right now. We want to share the knowledge about maternal and child health with schools, different campuses across UAB, across the UA system, and in our community. We usually hold monthly meetings, and we have seminars, networking events like what Julie mentioned that we will be having with Britta. And then we also do some fundraising events and a lot of other events that are still in planning. Okay. Now this is something like it's this pretty much the same that I've been talking about. We want to enhance our education, so something more than just learning about it in education, again studying about it, how we can learn to advocate or just network with people who are in the field of maternal and child health. And we want to also create opportunities for all of the students so that they can interact with the faculty members like Dr. Martha Wingate, like she is the head of its COP. But we also want to give opportunities for students to interact with other faculty members. And also we want to promote the field of MCH within like the university and the community. And we do fundraising. We used to do it actually before the whole COVID thing, but we also have social events, networking events. Just in December, we had just like a small get together to know each other better, because I'm sure most of us have not met each other. So just a few social network events that can help you interact and just learn more about each other as well. And yes, I'm going to let Drashti take over. She's our vice president, and she also handles most of the social media network, and she'll talk to you about it. Thank you.
Thank you, Zoha. Hello, everyone. So I'll make it real quick. I'll encourage all of you to connect with us through our social media network. And I'll show you 3 slides which will, show how our social media pages look like. So, Julie, if you can go next. So this is our Engage page from where you can register and be a part of our organization. We have a membership form and a link to our all social media web pages, including Instagram, Twitter, and Facebook. So speaking of Twitter, this is what the Twitter page looks like. Next. Okay, so first is Instagram. Okay, so Twitter page looks like what you see on your right side, and Facebook and Instagram page on your left side. You can just join, and this way you can be updated with all the upcoming events, what is going on with MCHSA, and everything which is going within the organization will be posted. Yeah, I'll transfer that to Madeline. She is the secretary of MCHSA. Thank you for joining.
Hi, everyone. Like Drashti said, I am Madeline Pratt, and I'm the secretary. This is my, I think, 5th semester being the secretary. So we do have a new MCHSA blog that we launched a couple weeks ago, last week, 2 weeks ago. And only members can submit posts for it, but all members can submit, and it can be any pieces that are related to MCH in any way. And as we heard earlier, there's lots of different options for how to relate them back to MCH. So Julie, if you could just go to the next one. So if you are a member, you can submit to the blog through Canvas, and we really hope everybody will be submitting. We're going to be posting once every 2 weeks for now. So everybody check out the blog link that Zoha just put into the chat, and then if you're a member, please consider submitting something.
And also, when you join MCHSA, you automatically become a part of the Canvas page. So you wouldn't have access to the Canvas page until you were a member. Just as a wrap up, even though so much of MCHSA's activity is sort of rooted in the School of Public Health and in the Department of Healthcare Organization and Policy, it is certainly not limited to that department. Its membership is not limited to the school. Anybody from across the campus, undergraduate or graduate, that has any kind of an interest in maternal and child health, excuse me, and how it can shape and flavor what it is that they do. They may be focusing on health administration or business administration or education, but if they want to expand what they plan to do professionally with that MCH perspective, we're here for them. And we'd love to have any of those folks join the organization along with clinicians and along with public health students. So with that, if there aren't any other questions or comments, I'm gonna let you all go 6 minutes early, and thank you so much for joining us. And we'll make sure and have the recording of this tonight's event posted on our Engage page. It'll be in our image gallery. We've got our images sort of divided into 4 categories. One is like what we do in terms of education. One is what we do in terms of just social and living life together, what we do in terms of fundraising, and what we do in terms of community service. And so if you'll go to the education gallery, it'll be one of the videos down there, and they'll probably be uploaded tomorrow. So thank you all, I appreciate it. And with that, I'll close the meeting.